Clinical vignette. Identify the type of leukemia. Case 1. A child with fever and bruising. A 6-year-old boy presents with fever, fatigue, easy bruising, and bone pain for the past 2 weeks. His mother noticed that his gums bleed easily and that he has multiple petechiae on his legs. Laboratory findings. Test result hemoglobin HB 7.8 grams per kilo, white blood cell WBC count 35,000 below elevated, 40,000 below. Peripheral smear, presence of lymphoblasts, bone marrow biopsy, hypercellular marrow with 25% lymphoblasts. Flow cytometry, positive for TDT and CD10. Question: what is the most likely diagnosis? A. Acute lymphoblastic leukemia, ALL. B. Acute myeloid leukemia, AML. C. Chronic lymphocytic leukemia, CLL. D. Chronic myeloid leukemia, CML. Correct answer: A. Acute lymphoblastic leukemia, ALL. Explanation: this child has acute lymphoblastic leukemia, the most common childhood leukemia, peak age 2 to 5 years. Key features of ALL: pancytopenia, leads to anemia, thrombocytopenia, and neutropenia. Bone marrow failure symptoms: bruising, frequent infections, bone pain. Lymphoblasts on peripheral smear. TDT, terminal deoxynucleotide transferase positive, marker of immature B or T lymphocytes. CD10 positive suggests B-cell origin. Associated with Down syndrome. Treatment: chemotherapy, vincristine, prednisone, methotrexate, 6-MP, CNS prophylaxis, intrathecal methotrexate, bone marrow transplant in high-risk cases. Why not the other options? B. Acute myeloid leukemia, AML, would show our rods and myeloblasts, not lymphoblasts. C. Chronic lymphocytic leukemia, CLL, affects older adults 60 years old with smudge cells on smear. D. Chronic myeloid leukemia, CML, associated with the Philadelphia chromosome, T922 BCR-ABL, and shows basophilia. Alternative clinical vignette for AML. A 50-year-old patient presents with severe fatigue, gingival bleeding, and frequent infections. Labs show pancytopenia with myeloblasts and our rods. Diagnosis? Acute myeloid leukemia, AML. Would you like images of peripheral smears or flow cytometry findings for different leukemias?